Good evening, everyone. If you'll take your seats. Do you want to say a few words? Good evening. I'm Lauren Meister. I'm the mayor of the city of West Hollywood, and I'm here to welcome you to this panel on the monkeypox virus. Thank you so much for coming. Thank you so much for wanting more information. We appreciate you being here. I want to thank our very esteemed panel for being here, and looking forward to hearing more about this, because as we know, awareness makes a big difference and knowledge makes a big difference. I'd like to introduce one of my colleagues, Mayor Pro Tem Seppi Shine.
Hi, everyone. I also want to thank our panelists and staff and the Los Angeles Blade for helping to bring forward this town hall, and my colleague John Erickson, who brought forward the co-sponsorship that we all approved of. The stigma that has occurred with regard to our gay community, with regard to bisexual and gay men, has been absolutely horrific around monkeypox and homophobic against the LGBTQ community. And we in West Hollywood, in the city of West Hollywood, denounce all of that. And as always, we stand with our community to bring forward knowledge and education and resources. And there's going to be some good news that is going to be announced on this panel tonight. I'll leave it to the panelists who will announce that, and I hope that it is an informative night. And we on council really have already urged the federal government as well as our state and county to do more, and we must do more. So thank you for coming, and enjoy this evening.
Now I'd like to introduce Teresa Lamb Simpson, who works in the office of our favorite Congressman Adam Schiff.
Good evening. It's a pleasure to be here on behalf of Congressman Schiff. Can you understand me with the mask on? Okay, very good. From Congressman Adam Schiff. Over the past month, monkeypox virus cases have exploded in Los Angeles, across the country, and around the world. And as the data shows, this virus is disproportionately impacting members of the LGBTQ+ community, particularly gay and bisexual men. While global public health leaders have stated they are taking the spread seriously, I continue to have serious concerns about whether our federal response is robust and urgent enough to meet this moment. That's why I want to light a fire under them. Earlier this month, I sent a letter to the Biden administration urging them to use all of the resources at their disposal to protect our communities, including ramping up vaccine manufacturing and distribution, supporting more healthcare provider and community outreach, and developing a long-term strategy to ensure access to monkeypox virus testing, vaccination, treatment, and public education for years to come. These are just some of the steps we must take to stop the spread, but we must take them now before it gets out of control. We must heed the critical lessons we have learned during the COVID-19 pandemic and AIDS epidemic, and be much more forward-thinking in our efforts to combat the spread of viral infections, particularly in instances when marginalized communities, such as the LGBTQ+ community, are hardest hit. We have the tools we need to do so. The federal government must use them now. Thank you so much.
Thank you, Teresa. And now I'd like to introduce Troy Masters from the LA Blade, who really made all of this possible this evening. He organized the panel. Thank you so much.
I want to thank everyone for showing up tonight. That's the most important step we can do at the moment, is to show up for our community. And I want to say that, you know, we are happy, we happily live in one of the wealthiest places on earth for LGBT community care. We have the largest network of community clinics for LGBTQ and HIV. And I know that with their support and with the support of the LA County Department of Public Health, we've got this. A lot of news is going to happen from this event tonight, and I'm excited to hear about that. I just learned about it myself. And, but before we proceed with the panel, I want to thank all the sponsors. Some of you are here, and if you're here, please stand up. Let's start with Wallace Memorias. WeHo Times is one of our sponsors. Black AIDS Institute, Trans Latina Coalition. We've had a very generous support sponsor from Bavarian Nordic, who's the maker of the Genios vaccine, which the LA County Department of Public Health is here to talk about. Latino Equality Alliance. We have APLA in the house. Grindr has been a generous sponsor. The Ariadne Getty Foundation, the Los Angeles LGBT Center, Equality California, the APATE, the Asian Pacific Alliance Group, and the AIDS Healthcare Foundation. But of course, I couldn't have done this without the city of West Hollywood, and I am so grateful. I'm also grateful that we live in a city that is so forward-thinking and progressive as both Los Angeles and the city of West Hollywood are. So with that, I want to turn this over to John Finoglio from KTLA, who is here tonight to be moderator, and he'll introduce you to the panel.
Hi, good evening, everyone. Thank you so much for being here. My name's John Finoglio. We have a lot of ground to cover tonight, a lot of questions to ask, and so we need to get moving. I just first want to say, Troy, thank you so much for having me. It really is an honor to be here, and especially thank you to our panelists, and of course, all of you for joining us. This is an important topic, and we need to understand more about it. We may be frustrated about what we're going to hear tonight. We may not like the answers we're going to get. All of that is okay. We need to remember that we are all here because we want to know more about this. The spirit of this forum is one of understanding, and it is one of education. We're going to be discussing a lot of items. I hope that we'll be able to drill down on several in particular. The federal government's slow response and where we are now, specifically with respect to testing and vaccine distribution, are our public health organizations getting the resources they need to make an impact in our communities. Number two, the infrastructure of the LGBTQ health system. Some of these folks are here tonight. There appears to be a lot of frustration that these organizations have not been adequately involved in the testing and vaccine distribution rollout. That's a problem. These organizations are experts at dealing with the intricacies of the queer community and our history with health emergencies. As many in this room know, these organizations were actually created as a response to a life and death matter and have since been repurposed and are now in our community and are now experts at what they do. They are also on the front lines for providing health care to those folks who are working class, don't have insurance, or otherwise don't have anywhere else to turn. They are vital, and they need collaboration and support with our public health agencies as we battle this current public health crisis. And number three, I would just say, please remember, there is no room for stigmatization. Conflating this virus solely with sexuality will only lead to more illness and suffering. We know that the CDC has already discovered the virus in a pregnant woman and at least 2 children. We also know that from prior outbreaks, a virus anywhere is a virus everywhere. How we respond to this current crisis will determine the health and safety of all of us. How we respond to this crisis will determine how we write our history with respect to this current outbreak. So with that, let's get started. I want to introduce first Dr. Leo Moore, Medical Director for Clinical Services at the Los Angeles County Department of Public Health. Dr. Moore.
Good evening, everyone. First, I'd like to just take a moment to thank the City of West Hollywood. I'd also like to thank Troy Masters and LA Blade for having us here tonight. And I'd like to thank all of those who are in the audience and those who are watching live. As mentioned, I'm Dr. Leo Moore, Medical Director for Clinic Services for SPAs 1 through 4 for Los Angeles County Department of Public Health. I'll provide a situational update on monkeypox in LA County, demographics of our monkeypox cases, and signs and symptoms for monkeypox. And then my colleague, Dr. Kim, will provide information on our vaccine efforts. I'll go ahead and take the first slide. Awesome. On Saturday, the World Health Organization declared monkeypox a global public health emergency, which is their highest alert level. While this designation doesn't mean a disease is highly transmissible or lethal, it is an indication that monkeypox is a public health risk requiring a coordinated international response. As of July 25th, there are over 16,800 cases of monkeypox across more than 74 countries. This includes nearly 3,000 confirmed cases in the US from 44 states, including 356 cases in California. To date, as of today, there have been 261 cases of monkeypox identified in LA County, which is an update from my slide. All of our cases have been in adults with the median age of 35 years. Additionally, whereas 2 weeks ago, over half of the cases in LA County were associated with domestic and international travel, now less than 40% of cases are local transmission. I want to emphasize that there have been no hospitalizations or deaths in LA County, and the risk of monkeypox in the general population remains very low. I'll take the next slide. As I mentioned before, public health is continuing to investigate cases and conduct contact tracing to learn more about how widespread the virus is in our community. This past Friday, we shared our first look at the demographic and geographic profile of monkeypox cases in LA County. Overall, all of our cases were male, with 138 or 85% identifying as LGBTQ, which is why we're all meeting here today. We've had no cases identified in transgender men or women. Additionally, 43% of the cases were white, 32% were Latinx, and 7% of the cases were Black. I'll take the next slide. Due to the large size of LA County, it's been divided into 8 geographic areas. These geographic areas are called service planning areas, or SPAs. As of Friday, the highest percentage of cases, 55% or 89 cases, were in SPA 4, which includes West Hollywood, downtown LA, Boyle Heights, and Echo Park, for example. And that's represented by purple on the map. 17% or 28 cases were in SPA 2, which includes the communities of Burbank, Calabasas, Canoga Park, San Fernando, Sherman Oaks. The remaining SPAs had 10 or fewer cases. I'll take the next slide. People with monkeypox sometimes develop a flu-like illness with fever, fatigue, muscle aches, and enlarged lymph nodes, followed by a rash. In many instances with the current outbreak, people are developing a rash with or without swollen lymph nodes, which can occur in the genital region, perianally as well, but we're also seeing rash occur all over the body, including in the face, near the eyes as well. People usually develop monkeypox symptoms 7 to 14 days after being exposed, but can develop symptoms up to 21 days post-exposure. Most people with monkeypox have a mild illness that improves without treatment over 2 to 4 weeks. Treatment is supportive and focused on easing the symptoms of the illness. Monkeypox is contagious and can be spread to others until scabs have fallen off and a new layer of skin has formed. As a reminder, there are no specific approved treatments for monkeypox infections. However, medications such as antivirals may be used to ease the symptoms of illness. In some cases, vaccine, which Dr. Kim will lay out shortly, can be given to prevent the disease after exposure to the monkeypox virus. Anyone who thinks they may have monkeypox should contact their healthcare provider. Anyone who doesn't have a provider or health insurance can call 211 or visit a public health sexual health clinic near you. If you're sick and could have monkeypox, it is recommended that you delay travel by public transportation until you've been cleared by a healthcare professional or public health officials. I'll take the next slide. To prevent the spread of monkeypox in Los Angeles County, we ask individuals to be aware of the risks and how monkeypox spreads. It's also important to remember that monkeypox can spread through sexual networks. As such, and until we learn more, we urge everyone to be vigilant and protect yourself. Additional steps include avoiding contact with materials like bedding and clothing that has been in contact with a sick animal or person infected with this virus. I'll also mention that there have been no animals that we have detected monkeypox in. Avoiding contact with people who are or may be sick with the virus, and avoiding contact with animals that could have the virus, such as animals that are sick or that have been found dead. Washing hands with soap and water, or using an alcohol-based hand sanitizer after contact with infected animals or humans. I'll take the next slide. We also know that there are a lot of questions about testing and what someone should do if they think they have monkeypox. The first thing I want to make clear is that most healthcare providers do have the ability to test for monkeypox. And residents that have developed a rash that they think may be monkeypox should contact their doctor to get tested. If residents don't have a provider, they can call 211 for a referral to a provider who can test them. And finally, residents who are having difficulty finding a place to get tested can visit a public health sexual health clinic for evaluation. You can find locations and hours by visiting ph.lacounty.gov/monkeypox. And now I'll turn it over to Dr. Kim to talk about vaccines. Thanks, everyone.
Good evening. Thank you so much for inviting us here to speak to you. Really, really grateful for this opportunity. So I'm going to be talking about where we are with our vaccine strategy to date. So next slide, please. Okay, so to start with, just really want to emphasize, and I think you all know, that the supply of Genios vaccine from the federal government has been and continues to be extremely limited. Our initial allocation, as you can see here, was a little more than 1,000 doses. We quickly administered those doses to those who had high risk of exposure to our initial monkeypox cases. For phase 1, Los Angeles County received a little more than 6,300 doses out of 56,000 that were distributed to various jurisdictions across the country. This was followed by an additional 9,812 doses that was received from the federal government in what was called phase 2A, which was out of 144,000 total doses in the US. Then we received our most recent allocation last week of just more than 6,800 doses out of 131,000 total doses in the US in what the federal government called phase 2B. So to date, LA County has received just over 24,000 doses of the monkeypox vaccine, of which 16,000, or 2/3, have been distributed to our public and community vaccination partners. So in total, we have received about 7% of the total 331 doses that have been made available in phase 1 and 2. So of those that we have distributed, so 16,000, about 70%, have been administered. So our goal this week is to exhaust our supply and administer nearly all of the 24,000 doses by Sunday. We will keep a small percentage for standard post-exposure prophylaxis for our close contacts, but we really want to get this into people's arms by the end of the week. So the federal government will be moving into phase 3 of their vaccine distribution plan, which is slated for August. In phase 3, the federal government is expected to receive and distribute 786,000 doses of the Genios vaccine across all jurisdictions. So we don't yet know what LA County will be allocated, and then depending on the timing of arrival of these doses, we may receive the phases starting in the next couple weeks. Next slide, please. All right, so now I'm going to talk about vaccine eligibility. Residents who are eligible for vaccine now fall into two groups. The first group, Group A, are residents who are identified through public health investigation and invited to get vaccinated. These residents have been eligible for vaccine since we had administered doses when we started back in May. They include persons confirmed by public health to have high or intermediate risk contact with someone with monkeypox. So that's someone with skin-to-skin contact or prolonged exposure to someone with monkeypox, as defined by CDC. And persons who attended an event or venue where there was high risk of exposure to an individual with confirmed monkeypox through skin-to-skin contact or sexual contact. Public health works with event and venue organizers to identify persons who may have been present at that event and at risk for exposure, and then extends invitation to these people. The next group, Group B, is where we expanded eligibility last week. Group B applies to gay or bisexual men and transgender persons who meet any of the following criteria. They were diagnosed with gonorrhea or early syphilis within the past 12 months. So this criteria had been previously limited to 3 months diagnosis, and also the diagnosis for gonorrhea had been specific for rectal gonorrhea, which we now have expanded to all gonorrhea. The second criteria is an individual who is on HIV pre-exposure prophylaxis. Or the third criteria is attended or worked at a commercial sex venue or other venue where they had anonymous sex or sex with multiple male partners. So for example, saunas, bathhouses, sex clubs, raves, etc., within the past 21 days. So if someone falls under Group B, there are several ways that they can get vaccinated, which I will be going into detail in the next slide. So next slide. Great. So there are 4 pathways for people to access vaccine. And I want to apologize that this is so complicated, and we're hoping with our next allocation, if it's large enough, we can really simplify this. But at the moment, there are 4 pathways. The first is that people can contact their doctor or healthcare provider to see if they're a monkeypox vaccine provider. We now have a list of providers who are actively vaccinating on our website. There are at least 20 community provider vaccination sites, and this list is growing every day. We plan to update this list hopefully tomorrow as new providers have started to vaccinate. The other option is people can visit a public monkeypox vaccine location, which are our public health pods. They can bring their ID and provide one of the following. They can provide proof of gonorrhea or early syphilis infection in the last 12 months in the form of a lab report. Or they can provide a monkeypox provider attestation form completed by their doctor. So they can ask their doctor to complete and attest that they meet one of the eligibility criteria, or at least one. So they can come with that form and come up to the public vaccine clinic, and that would be verification. Or, finally, a text message with your name from the Los Angeles County Department of Public Health inviting residents to get vaccinated. Next slide, please. So yesterday, Public Health made an additional 4,000 pre-registration slots available for our residents through an online portal. So the online portal is located there at that website. So what had happened was we opened that portal up at 9 a.m. and by 12 p.m. we had reached capacity. So we had reached the cap of 4,000 individuals. So for someone that did not have access to the internet to actually sign up in that portal or needed assistance, we had advertised that they could call 211 for assistance. So as I mentioned, we reached that 4,000 slots within a few hours and now have paused the sign-up form until additional doses become available. So all eligible residents meeting the vaccine eligibility criteria and who had successfully submitted that form will be notified in batches over the next 1 to 2 days. Some individuals may have received text messages today. We will be sending another batch of text messages this evening and then another batch tomorrow evening. So in that text message, residents can see and click to see how they can access the vaccine at our public vaccination sites. So as mentioned, this online portal is now paused until we receive additional vaccine supply from the US government, and we anticipate that to be in the next 1 to 2 weeks. So please do keep monitoring our website. Also sign up for our newsletter so that you can be alerted when the portal will open again. So thank you for the opportunity to provide this update, and we're happy to answer questions. Thank you.
So I just wanted to add on to what Dr. Kim said and make a quick announcement. As Dr. Kim mentioned, we are working to get all of the doses administered by Sunday, but we are not waiting to plan for when we have additional doses. And so I just wanted to announce that we're working very closely with City of West Hollywood, and to thank the City of West Hollywood team, Andy, Yvonne, Derek, David, for working closely with us on a mobile vaccination site that we plan to launch here as soon as we have additional doses. So we're looking forward to that. Thank you all.
Thank you, doctors. I'm sure we're going to want to hear much more about that mobile vaccine site. There'll be questions for that coming up in just a moment. We want to talk now with Matthew Ford. Matthew Ford is an actor, writer, and video producer who spends his time between here in West Hollywood and New York. He recently recovered from monkeypox, and he can speak firsthand about what his experience was like. So please welcome Matthew.
Hello there. Just wanted to say, firstly, thank you for everyone who showed up for this and for people tuning in at home. Very much appreciate your time and discussing this important topic, and to our hosts and sponsors for having me. And to preface this by saying, unlike my esteemed fellow panelists, I am not a doctor, a medical provider. I don't do this for a living, but I can speak a little bit about what my experience was like and, some opinions I have from living through this. So on Friday, June 17th, I got a call from someone I had been around the weekend prior, informing me that he was like 99% sure that he had monkeypox. He was just waiting on a confirmed test result from the LA County Department of Public Health. After that call, I noticed a few lesions that I had not noticed before. I hadn't even felt them, up to that point. So it became pretty clear pretty immediately that I likely had monkeypox, and from then on I was in touch with my doctor and the LA County Department of Public Health. A few days later, I was able to go in and get a test, which the following Friday came back as positive, so a week after when I first became aware that I had been exposed. Through the course of that first week, I developed very intense flu-like symptoms. I had a cough, sore throat, fever, full body chills. I was sweating through my sheets at night. It was a quite miserable experience. And, those symptoms lasted around 5 to 7 days, if I recall correctly. And as those began to abate, more and more lesions began to appear all over my body. The first lesions that appeared were on more sensitive skin and more sensitive areas, and then shortly followed by more on my face. And then as the infection went on, they appeared all over my body, arms, feet, shoulders. I think there was one on my scalp. I counted more than 25 total. And at worst, these were excruciatingly painful, constantly, to the point that I was unable to sleep at night, and I had to go back to my doctor and be prescribed narcotic painkillers in order to be able to even go to sleep. And at best, the ones in less sensitive areas were still itchy and irritable and, not fun by any means, but I really want to emphasize how incredibly painful it is for people who have severe cases, because it can be difficult at times to grasp someone else experiencing that level of pain, I've found, and trying to communicate this with people. But when it is so bad that you literally can't even go to sleep, and the only thing that helps is sitting in an Epsom salt bath for an hour at a time or so, it is a very not fun experience, to say the least. Shortly after those lesions began to appear all over my body, the pain in the more sensitive areas began to let up a little bit, and in total my recovery time was 3 weeks and 3 days. It's also worth mentioning that in that first week I was voluntarily isolating, but once I had a confirmed positive result, I was issued a court-ordered stay-at-home mandate from LA County. And so 3 weeks and 3 days into my infection, I was able to go into the clinic. They inspected my lesions, they cleared me because every single one had scabs, fallen off, and had smooth, healthy skin underneath. So that was my experience, kind of in a nutshell. It's worth noting throughout this that I was one of the first people to come forward publicly and speak about my experience. And I say that because, in the aftermath of that, and some of my tweets or TikToks or whatever going viral unexpectedly, I had a great number of people reach out to me and comments and DMs. People I knew, acquaintances, a lot of total strangers from states all across the country, other countries outside of the US, telling me how much pain they were in and how afraid they were. A lot of them didn't have access to great medical resources. A lot of them weren't familiar with how to get tested, what kind of antivirals or treatments existed. So hearing all that obviously caused me a great amount of concern, and I began to do a great deal of research on all this. And, I applaud to hear the efforts that are underway here in West Hollywood. I'm very glad that we're getting more vaccines in arms ASAP. A lot of concerns I have are more at the federal level with the federal government, and it's, in my honest opinion, lackluster and slow response to this outbreak. It is my citizen patient turned advocate opinion on this that, there are a lot of different things that need to be improved in this, including, the vaccines. It's great to hear that we're getting more of them from this warehouse in Denmark where they've been stuck in limbo, but we needed more of those weeks ago. So I'm glad that that is being taken more seriously. An increase in the quantity of tests. I've heard in different cities that people sometimes show up with symptoms and aren't even able to get tested. So an increase in the quantity and a decrease in the turnaround time, and especially the antiviral tecovirimat or TPOXX. I know a great number of people who were not able to access that medication, myself included, which anecdotally, at least from what I've heard, helps immensely with the recovery time and with this the very painful symptoms. So the CDC recently has loosened some of that red tape. I hope that that continues to be the case and that people are able to be prescribed that ASAP who are suffering in real time and are able to get a little bit of relief. So thank you again for having me.
Thank you for that, Matthew. Right now, we want to bring to the podium Dr. Matthew Mimiaga. He's the director of the UCLA Center for LGBTQ Advocacy Research and Health. He is also the chair of epidemiology at UCLA Fielding School of Public Health. Dr. Mimiaga.
Thank you for having me, and welcome everyone. And let me take this off. And Matt, wow, thanks for sharing your story and for being such a motivation to the community. It's really impressive. A recent meta-analysis examining the prevalence, can you go to the next slide, sorry. Examining the prevalence and spectrum of neurological and psychiatric presentations of monkeypox showed that among the various symptoms, muscle pain and headache were present in 50% of the study population. However, more severe neurological complications such as encephalitis, confusion, seizure, have also been present in having a low prevalence among monkeypox infected individuals. Studies reporting psychiatric symptoms have indicated that the prevalence of anxiety and depression, as well as low mood, have been high among hospitalized patients with monkeypox infection. Many also have suffered from suicidality. However, none of these studies that were part of this meta-analysis used clinically validated assessments for psychiatric illness. In addition, the uncertainty is taking a toll on our community, as Matt just explained, particularly among gay and bisexual men and other men who have sex with men. who are worried about monkeypox infection. Some of us may worry about getting sick. Some of us are fed up with having to deal with another pandemic. We just are somewhat through COVID and now this. In addition, people are worried about how long this will last and what the future really brings with respect to this. Many are experiencing stress, anxiety, depression, fear, sadness, loneliness, and existing mental health problems such as depression and anxiety can worsen. Next slide. With respect to monkeypox and factors that potentiate stigma, the emphasis on same-sex sexual acts has been flagrant at times. In addition, media conflating monkeypox and sexuality stigmatizes the gay community and bears the risk of driving people away from seeking healthcare services and prevention services. This can be a huge barrier in identifying incident cases of monkeypox and may foster ineffective punitive measures. There has also been a racial dimension to stigma. For example, initial Western reporting on monkeypox extensively used stock images of dark-skinned people with visible rashes on their body. This mischaracterization stigmatizes Black individuals and creates misinformation about those who are at risk. Next slide. Next slide. Some things that we can do, psychological support for those who are experiencing monkeypox and are experiencing isolation or quarantine must be made available. Self-care strategies are good for, mental health, taking care of your body and your mind within the context of others may benefit your mental health. And it's particularly important to motivate your friends around prevention services and getting vaccinated and seeking help when you might need it or when you're feeling symptoms of depression or anxiety. Ask for help when you need it. And also, stigma, may make people feel isolated and even abandoned and harms people's health and well-being. So just being cognizant of that. Some things that we can do when stigmatizing things are said in the media to, address them right on the spot. And then also reaching out to people who feel stigmatized in our community and letting them know that you're there to support them. And that's it. Thank you.
Dr. Mimiaga, thank you so much. A large part of the LGBTQ community exists online, especially on dating apps. With that in mind, we'd like to welcome to the podium Dan Wolfheil. He's the co-founder of Building Healthy Online Communities. His organization is a partnership of public health leaders and the owners of these dating apps. Dan.
Thank you. I want to thank the LA Blade, the City of West Hollywood, and all of you for being here, and the sponsors. One of the most important messages we've been giving out through the apps and in all of our conversations is don't panic. Monkeypox is clearly serious. It can be painful, but people aren't dying from it, and it's very different from other pandemics and epidemics we've all lived through. I want to start by talking about what have we learned through from the 40 years of HIV that many of us have gone through. One is the importance of knowing people who had HIV, and obviously that stands true today, knowing people who have monkeypox, and that makes it real for us, and it also can help fight stigma if people are coming forward. In 1983, I saw a young man named Mark Feldman get up in front of a crowd about this size in a San Francisco synagogue, and he talked about having HIV, and he said, anybody that wants to come to the front of the room and see my lesions, you can come and do that. And it was an incredibly powerful moment. And now we've got Matt and others coming forward and talking about their experience and their symptoms, which thankfully aren't as serious but are clearly painful. And I think we really owe Matt and others a big thank you. And I also want to thank the person who notified you that he had been exposed and that you might too. It's something we can all do. I ran a program called Stop AIDS in San Francisco, and it was one of the largest HIV prevention programs run by and for gay and bisexual men. And most of us don't get up in this field and say we failed, but quite honestly, after 8 years of running the program, we showed no difference between people who had been involved in Stop AIDS through one way or another and the people who hadn't in terms of their number of infections. So one of the reasons that happened is we were concentrating very much on the question of why do people take risks? And the reasons that all of you know are, I was in love, I was drunk, I was lonely, I was horny. And those are all factors, but one of the biggest factors that affects our risk is the risk that our partners are taking, the risk that their partners are taking, and the risk that their partners are taking. And that's what we call a sexual network. It's groups of people who are sexually connected, and you can think of it as the 6 degrees of separation phenomenon. The size of networks is really important in spreading any infectious disease, and not that I want to keep going way back to the past, but I'm going to. One of the biggest factors in bringing down HIV infections in San Francisco was the reduction in number of partners. And Bill Krause and Cleve Jones, who many of you have heard of, who worked for Harvey Milk and founded the NAMES Project, and Ron Huberman in San Francisco, published the following in the Bay Area report of the San Francisco Gay Paper in 1983. And they said, right here, right now in San Francisco, there are over 200 cases of AIDS. And we have decided not to be passive victims of this epidemic, but to take serious steps to protect ourselves and by making serious changes in our sex lives. We have stopped going to baths and similar places. We have greatly reduced the number of our sexual partners. And what they did was important, and what San Franciscans did was important because even before most of our agencies were created, they were reducing the impact of the networks. And we're hearing people do that in San Francisco right now. 40 years later, the community is already stepping up. We hear that some of the owners of sex parties are canceling it, not just because there aren't a lot of people coming, but because they think it's the right thing to do to keep people safe. We're also seeing people like Matt and lots of others take action by telling their own stories. You can go online and see, well, the bad news is we're seeing more cases. The good news is more people are coming forward. There's also a lot of mobilization taking place right here among people in this room to advocate for getting vaccines, more of them, and quick. I want to just state that the virus cares about networks. It doesn't care about our identity. The Republicans may care about our identity, and they're always going to do that. And what we need to be thinking about is how we take care of ourselves and how we affect those networks. And one of the ways that we can affect networks is through the internet, which is obviously a network in and of itself, and apps can definitely play a role. So while people blame them for a lot of STD and HIV prevention, for a lot of cases, sorry, they also play a key role in prevention. In terms of messaging, some of the apps have stepped up right away. Grindr has sent 3 messages out nationally, which is a big lift for them. We've also had Hornet, Sniffies, Pause Personals, Adam for Adam and Growler send out messages, and we continue to go to the other apps and engage them in conversations about what they can do in terms of informing people about how they can take care of themselves and how to find a vaccine. We do large national surveys every year to find out what features app users want that can help us all stay healthy. And some of these are very important because we can't always be there as public health on the apps. And yet there are features we can build in, such as profile options that allow people to help understand what their partner's sexual health strategies are and what risk they want to take or not. That includes HIV status, listing whether you use condoms or not, whether you're on PrEP, whether you have an undetectable viral load. And we're already seeing some people add, I've already gotten vaccinated for monkeypox on their profiles. I think we have a lot of work to do to help people understand what exactly does that mean. You took it a week ago or 2 weeks ago, and clearly that's not going to offer the kind of protection we all want. The apps are also doing, we've built in testing reminders with them, and they're also providing links to information about HIV and STDs, about COVID, and now about monkeypox. And we're working with them continuously to find out what else they can do, and I'm hoping some of my fellow panelists and some of you will have ideas of what else should we be asking apps to do. One thing that's really important from a network perspective is the more you know about your partner, the better. Using apps is a way we can exchange information. Putting information in your profile can be a lot easier than having a conversation in person when you're already in bed or wherever you are. If you don't want to notify, it also helps you notify a person if you've been exposed, that they also may have been exposed. And if you don't want to do it in person, we created tellyourpartner.org, where you can do so anonymously and let them know. It's also important to consider creating pods. Many people did this during COVID with the number of people they wanted to spend time with. And what it basically means is a lot of people are creating small numbers of people that come to a mutual agreement that they're only going to have sex with people inside that group and have very clear agreements about what those strategies are going to be and commit to doing it, having sex just with the people in your pod so it doesn't spread further. I'd like to leave you with just a couple thoughts. One is hang in there. This has been yet another traumatic time for a lot of us. Hopefully vaccine access will significantly increase in the next 6 to 8 weeks, and even sooner is what we're hearing. We're engaged in discussions about how to create a directory that can be national and help people understand on as frequently a basis as possible, how do you find a vaccine near you. And finally, the more steps that we take as individuals, starting now to protect ourselves and our partners, the sooner we can end this outbreak. And we'll all be able to take the same kind of pride that many of us can take in all the efforts that we took to end as many, or to at least minimize as many HIV infections as we could, and we still need to do. Thanks very much.
Thank you, Dan. We talked early on about the importance of LGBTQ health systems and the services that they provide for so many millions of people. So we're going to hear from some of those folks right now. And first, I'd like to welcome Mariana Maraquin. She's with the Los Angeles LGBT Center Trans Wellness Center.
Thank you so much for having me tonight. My name is Mariana Marroquin. I'm the program manager of the Trans Wellness Center of Los Angeles, part of Los Angeles LGBT Center. The Trans Wellness Center is 6 organizations, 6 leader organizations providing services to more than 1,000 clients a year. I'm the trans person of the group, and I am very thankful to be here. I think it's important that if we are included in that list to get educated and to also have access to understand what's happening with monkeypox. For every one of us that have access to be part of to be invited to sit on the table, I want you to understand that there's so many trans people out there struggling, accessing and having to do sex work for a living, engaging in risky behavior because they need a place to stay. They need something to eat. And we need to make sure when we share information with the community that never forget about people in our community. Education and access are 2 important pillars of the Los Angeles LGBT Center. And with that being said, I'm always thinking about like who is not able to, go online and get an email, who is not able to receive a text message. We always need to keep in mind people who live on the streets, people who don't have access to that kind of technology. I also would like to talk about our resilience. The trans community, as we know, we educate each other, we talk with each other, we support each other. So we need the resources also to take care of each other. Let's not panic, let's share the communication. Let's make sure that we provide that space to learn together. And before I leave tonight, I want your commitment. I want your commitment to make sure that we always have a space on those decision-making meetings, you know. We need those resources to take care of each other because we know what's going on with our community. And just because someone is trans doesn't mean that they don't know how to, we don't know how to behave or how to access education. I think it's important to understand our behavior and to understand about what we engage into to make sure that education is specifically for our community. I don't know if we have media in Spanish, but I would like to say something in Spanish in case that's happening. Quisiera mandar un mensaje para la comunidad que habla español, que no se alarmen, que busquen y que tengan acceso a educación sobre monkeypox y que se unan y que todo el estigma que a veces estamos lidiando en la comunidad latina, la comunidad reciente inmigrante, reciba esa educación que es necesaria para cuidarnos y salir adelante y no tener miedo a lo que pueda pasar. Thank you.
Mariana, thank you very much. We have two more speakers, and then we're going to open up questions to the audience. Right now, please welcome Alexander Gonzalez with the AIDS Healthcare Foundation.
Good evening, everybody. Thank you again for having me today. My name is Alex Goncalves. I'm the Senior Director of Public Health Division for AIDS Healthcare Foundation. I oversee our STD programs. We have 36 STD clinics. We have 14 mobile units and 32 fixed site locations. On a monthly basis, we see about 18,000 clients. I want to talk about, not just on behalf of AHF, but also as a gay man, that I'm very disappointed at the way that the public health county is actually dealing with the vaccines. It actually takes me back to 2016 when the meningitis outbreak happened here in LA County, in which it took a while for the county or the state or the federal government to actually step up and do something about it. Again, it's been COVID for 2 years, the last 25 years with HIV/AIDS, you know, now another disease coming up abroad. So I wanted to say, let's put back the word public and public health. I think that the public health department needs to always rely on the community and the agencies that we have to make sure that we can make access and be equitable to everybody. Again, with the vaccines, it's also about, just like Mariana mentioned earlier, about making sure that we give access to not just the white gay man, but also thinking about all the gay men, all the trans people that we have in LA County. So making sure that everybody has the same equity and the same chance and opportunity to get access to the vaccines. Now, our panelists also mentioned about that we're still waiting to receive a lot more vaccines. So we need to think about, as a community, what are we going to be doing now to make sure that we're going to be prepared to get, once we get those vaccines, that we're able to get them out in the community right away. But also think about how we're going to be reactive and not just waiting around and waiting for vaccines, but what can we do now to be reactive to to monkeypox. On July 22nd, AIDS Healthcare Foundation also held a press conference in which we offered the LA County Department of Public Health some recommendations that we'd like to, actually I'd like to share with you guys here today. Sorry, I'm a little nervous, not sure why. So first off, we recommend that the LA County Department of Public Health should conduct twice weekly public briefings conducting number of new cases where they're occurring. I know at the moment they are sharing sort of the total cases that they're having, but I feel like the more data that is giving out to the community, the more information that the community will know. So even knowing as to where are these cases occurring might be something useful to the community. The second point would be to warnings to gay and bisexual male population should be launched online in newspapers and outdoors advertising, advising men to watch for symptoms, avoid group sexual situations, consult a doctor if you have a symptom indicative of monkeypox, and isolate if you are diagnosed. Third recommendation is to require signs to be posted in commercial sex venues via banner and other adults on the hookups apps, just as our panelists mentioned earlier. Also, targeting the commercial sex venues. As we know, those are some of the sites in which people are more likely to spread monkeypox. Fifth recommendation is regularly engage community partners to assist the Department of Public Health in preventing, testing, vaccination, and treatment for monkeypox. Again, the community looks into our community partners and for us to having the answers. For the Department of Public Health to please rely on the community partners and making sure that they involve us when they're making decisions as to locations, decisions as to how the vaccination is being disseminated, for them to also look at our agencies for help. The community is looking, they're calling our agencies, they're not calling them for answers, so I feel like we need to also be brought up to the table when you guys are deciding as to locations and hours where these POTS are happening. And lastly is to engage universities to initiate studies to determine the change characteristics of monkeypox in the current pandemic. Again, we're still learning a lot more about monkeypox, and we don't know sort of the correlation with COVID and HIV and AIDS, so I think also continuing to engage universities to do more research on monkeypox is also something important to this. Again, we need to just make sure that the Department of Public Health is engaging with community partners and making sure that we can help and disseminate. You know, our president, Michael Weinstein, has graciously offered all of our resources, our mobile testing units, our billboards, our marketing department, you know, all of our resources to try to help our community to make sure that we can get the vaccines out to the community faster. You know, it's taking too long. I have programs in other states, and I see how easy it is for my colleagues to get their clients in getting the vaccines into their clients. Yet LA County being such a big city, we're still struggling to get shots into our community members' arms. So thank you for that.
Equity and distribution of these vaccines is crucial, and it's something that we should all be talking about, and I'm sure many of you will have questions. But before we go there, our last speaker for the night is Dr. Wayne Ho. He's an internal medicine and HIV specialist with APLA Health and Wellness. He's also a professor at the Keck School of Medicine. Dr. Ho.
Hi, everyone. That was a great lead-in for the last panelist talk. I'll be talking about the actual vaccine. So we've heard a lot today about what is the disease, how is it spread, we're learning more about that, and who is being affected. But now I get the excitement of talking about the vaccine. What can we do to prevent the continued spread? So I'll be talking about what is the vaccine, what are the side effects, what's the efficacy of the vaccine as far as we know, and when should you get vaccinated? So let's talk about the vaccine Genios. This is the vaccine that we're currently using for monkeypox vaccination. And I'd like to share that the information I'm telling you today is from the package insert from the manufacturer and from the CDC. So this is a live weakened, non-replicating virus vaccine that we're using. What does that mean in plain English? It means that, yes, it is that actual virus, but it's not going to copy itself inside your body, so it should not be causing infection. And so that is a concern that some people have. It's a 2-dose regimen, which means that it is given at least 4 weeks apart. It is okay to give later than 4 weeks, and a lot of us are familiar with vaccine because of COVID, and the initial concern at the very beginning that, hey, I'm supposed to get a vaccine in 4 weeks, but I can't get it. Oh my gosh, should I be worried? At this point in time, based off the knowledge that we know, no. Wait till it is available for you and get your vaccine as soon as you can within the 4 weeks, but at least 4 weeks or later. What are the side effects when you do get the vaccine? So most commonly, and these are rough numbers, 50 to 80% of people will have an injection site reaction. We give the vaccine at the back of the arm under the skin. 50 to 80% of people will get redness, swelling, some pain at that site. And that swelling can last several days. From my experience, it can last up to a week, but it's fairly well tolerated. 40% will get body aches, and 30% of people will get headaches and fatigue. 20% of people will have nausea, and 10% will have chills. This side effect profile is similar for people with and without HIV, and similarly, people who have been vaccinated with smallpox vaccine have similar side effects as people who have not. So the big question, does it work? So we guess about 85% or more efficacy in humans. But what is this based off of? It's based off of animal models. So our information is pretty limited. This is the first time we will be using monkeypox vaccination in a global manner. So the information is still building, and again, this is reminiscent of vaccination during COVID. When it first came out, we needed to learn more information. So I think here, some patience is needed as we gather more information. How were the studies measured in terms of efficacy? We measured it 2 weeks after the second dose of the vaccine. We measured antibody response. So what does that mean in terms of how effective is it after one dose? I'm sorry to tell you, we don't have a lot of information. We don't know very much how effective this vaccine is after only one dose. We will learn more, but you will have antibody production. How much we don't know yet. So when should you get vaccinated? The ideal time is before exposure. And this is why the Department of Public Health is making a concerted effort to disseminate this vaccine as quickly as possible as soon as we get it. But the CDC has also clarified that if you have been exposed, and you've been exposed within the last 4 days, getting the vaccine may stop the manifestation of disease. And if you've been exposed within the last 14 days, getting the vaccine may decrease the severity and duration of symptoms. So in conclusion, I hope that everyone who fits the risk categories defined by the Department of Public Health will get vaccinated. And I hope with the Department of Public Health's effort, we will make that much easier and readily available for everyone who needs it. Thank you.
Doc, you got it? Test. No worries. Okay, it's time for some questions. I know I have a small program note here, really quick though. Councilmember Erickson, is there something you wanted to add?
Hi, everyone. Sorry I was late. I was dealing with my day job, which is Planned Parenthood, which is a whole nother topic of discussion. But I wanted to thank all of you, the center, all of our amazing organizations here tonight. This has been something that my colleagues and I know Lindsay, Lauren, Seppi, and John D'Amico care deeply about. So I'm just so thankful to see the community response. I'm so thankful to see these organizations which popped up as a result of the epidemic that we saw with HIV and AIDS coming up. And now this is the community response that we need, but we need to get more shots in arms quicker. And I'm so glad to see that the Los Angeles County Department of Public Health, which I was watching on the car right here while listening, is bringing a mobile vaccination site to West Hollywood. That is the first and foremost thing that should be done. I personally am having a hard time even getting my vaccine, so I'm really glad to see that this is occurring. So, and people don't have to drive to Santa Clarita or other areas where it's almost impossible with public transportation and equity that we've been discussing. So I'm so thankful to everyone sitting on this panel and for all that you do, and for all of you for being here tonight, and to the Los Angeles Blade, and to you, Troy, who's been sounding this alarm for such a long time. I really want to thank you for that. So thank you very much. Now to the question.
Councilmember, real fast, can you say when that mobile vaccine site's going to be open?
I believe it is going to be sometime hopefully in August once vaccinations return in those ways, but we're working every single day to make sure those vaccines get here quicker, and the FDA needs to do a lot more, and the county, being the largest county in the country, needs to demand, not say things like could ask for or should ask for. They need to demand that the federal government do what they should do, and for the president to keep his promise to the gay, lesbian, bisexual, and transgender communities.
Thank you. I know a lot of you have questions, so what we're going to do is we're going to use this microphone right here. I know you've been waiting, so just come up here if you would, orderly. Remember to keep your questions thoughtful and respectful. Again, tonight's forum, the spirit of this forum is one of cooperation and understanding, so let it rip. Please introduce yourself as well.
Is this on? Okay. Hi, everyone. My name is West. I'm a West Hollywood resident. I'm also a clinical research worker myself, and I have a comment before my question. Thank you all so much for speaking to stigma as, you know, an inhibitor of our public health response. Recently, in our local newspaper, I wrote an op-ed about medical freedom, and there were a bunch of comments directed at me that were like, basically disparaging me because of my political views and also because of my history as a former sex worker. And a bunch of the comments were like, you know, using monkeypox as like this scarlet letter to like shut me down or discredit me, and it really hurts. So thank you so much for speaking to that. My question is specific. So especially in light of vaccines not being available for everyone and the struggles with that, on PubMed there's a study that's looking at, it's an in vitro study of an herbal preparation of purple pitcher plant, which is Sarracenia purpurea, and it showed in vitro effectiveness in the early stages of viral transcription against monkeypox. So I just encourage you to look into that, and if you could speak to that if you have any familiarity. Thank you.
I'm Miss Loretta Lorraine. I'm here for my transgender community. I love them all. I do got my monkey shot right here. I just turned 81 years old, and I love my community. And I want to know, because like she said, I do just flip phone. If you're going to have flyers, where to go, locations, because a lot of us are not very educated on the new technology, where we have flyers and stuff to go to the locations where we got to go to keep ourselves safe. Because I would love my community to be safe, especially all my transgender community girls and the trans man and everybody else. God bless you all.
Thank you. Before we take our next question, thank you for that. Before we take our next question, let's give our panelists an opportunity to try to answer, I guess maybe the first one, public health. Anything you can add?
Thank you for that question. I was not aware of that, so I think it's just really important to look into it, to learn more about the science on that. So thank you so much for raising that. As far as the second comment that was mentioned, I want to remind everyone that you can always call 211. At 211, we constantly are updating our team to ensure that they know where our vaccine sites are located. And even when we reopen the website for pre-registration, if a person doesn't have a phone with internet and only has, a flip phone that may or may not have internet, that they can call 211 and can make an appointment. Anything? No? Okay, that's it. Thank you.
Thank you, Dr. Moore. Please introduce yourself.
Good evening. My name is Eric Matos. I'm a resident here in West Hollywood. First of all, I want to thank you all sincerely for being here this evening. This is so incredibly important, and the work that you're doing to bring a local vaccination site is so incredibly important as well. I want to address something that Dr. Moore had said earlier. I believe that you had stated that there was about 40% community spread and that the majority of cases were having something to do with travel. I wanted to see what is the, probability of infection occurring in a gym facility, specifically locally here in the community. Is that something that we should be concerned about? And then just a quick follow-up question regarding some of the criteria that was listed by, I believe, Dr. Kim. what does it look like to ask someone about multiple partners as a guideline for giving them a vaccine? There's some stigmatization in that, so I'm just curious as to what that looks like on the ground level. Thank you so much for being here.
Thank you for those questions. So I'll mention that in regards to the gym, we think that it's pretty low risk, but we do think it's important for everyone to wipe down equipment before and after use. And that's not just important for monkeypox, but also for COVID-19 and other viral respiratory diseases. So encouraging everyone to wipe down the equipment and also to think about distance and masking as well.
Hi, thank you for that comment. What does it look like to ask about multiple partners? I mean, that's a really good question. So we are partnering up with our community clinics who we know are already serving this population, and we really rely on their relationships with their patients to be able to have that conversation. But we do know that that is one of the primary risk factors is multiple male partners. You know, unfortunately, the at-risk population is a lot larger than the amount of vaccines that we have. I mean, there's estimates of the population size that ranges from 300 to 400,000, right? We only have 24,000 doses. And so of, the population size of gay and bisexual men, transgender persons, we don't really know what percentage of that population is at risk. If you think it's like 50%, we're only reaching about 10% of people. So really, we do need to be doing more. We need more vaccine. We need to be able to reach everyone that needs it. And those are people that are engaging in sex with multiple partners. So again, we do rely on the providers to really, find and do the outreach to the patients that they know are engaging in that behavior and offer the vaccine.
Any other questions from the public? Yes, sir.
What did you do? Did you take anything to recover?
Yeah, so my treatment was unfortunately mostly just managing the symptoms. That included maxing out my daily allotment of Advil, Tylenol, eventually narcotic painkillers, a lot of Epsom salt baths, creams, ointments, Vaseline on certain lesions because air interaction with them can cause pain apparently, and it really helped me. I was not able to access the antiviral, unfortunately. Yeah.
On the FDA website on June 30th, 2022, it says there's no data available yet on the effectiveness of the vaccines. And as to the Genios, it says to have appropriate medical equipment for anaphylactic reaction. Okay, we heard nothing tonight about how to stay healthy, how to practice safer sex, and that you'll heal yourself. Fatigue, headache, swollen lymph nodes, sounds like the flu and other mild illnesses that you can get and recover. There are no hospitalizations, no deaths, 4,000 cases in 5 million gay men in the United States. That's 0.08%. Monkeypox first appeared in 1970 in Africa, yet all of a sudden it's an emergency. In Nigeria, according to records, in 5 years, they had 200 cases in a country of 200 million people. So now that COVID is done, everyone is getting a shot. Is it all about the money? The sponsor tonight makes a vaccine. So what about practicing safer sex, living more healthier, improving your immunity by eating healthier, fresh fruits and vegetables, avoiding processed foods, toxic drugs, exercising detox, getting enough sleep and love? Why do we need a vaccine shot that's not effective? You recover naturally. And just one more thing from the FDA website on one of the drugs called Acam 2000. This is what happens when you get the injection. This is from the FDA. The virus begins growing at the injection site, causing a localized infection or POC to form. A red itchy sore appears at the site of the vaccination within 3 to 4 days is an indication that the vaccination was successful, that it's a take. I don't think you need to inject something in your body to heal yourself naturally as you did. Thank you.
So to be clear, we're going to try to answer some of that, and I'll let public health speak to some of those things. But is there any legitimacy to what this gentleman just asked? And we don't have to lend credence to wild speculation, but I'm sure a lot of people do have questions about the efficacy of the vaccine and whether or not it's actually effective?
I'm actually going to turn the efficacy question on over to Dr. Hope.
Sure. You make a great point. In terms of efficacy, we really don't have a lot of good human data. We have a lot of animal data, but we have to extrapolate that at this point because this is the best thing we have at this time. In terms of Acam 2000, it has more side effects than Genios. So this is not something that we are currently using to vaccinate people against monkeypox. So you're absolutely right. There are definitely more side effects with that vaccine. I think you bring up a good point, which is overall health. Of course, I think that is a strategy we should all use. I think keeping yourself healthy as best as you can is important, but this is an infectious disease. Much like coronavirus, COVID-19, keeping yourself healthy is very important, but it does not necessarily mean by maximizing that you will prevent transmission of a virus. So I did want to emphasize that point.
I'd like to also add to that because in my clinics, we are seeing patients come in with multiple lesions, perianally, lesions on their foreskin that's leading to swelling and them being unable to urinate, and even in those perianal lesions being unable to defecate, and people even concerned about lesions within their urethra affecting their ability to urinate. So in those cases, and in cases that Dr. Mimiaga mentioned around encephalitis, the antiviral that is now available is critical, in addition to pain medication to help mitigate those symptoms and help calm and cure that virus. So I think, having these resources available is really important. And I agree that it's great that Matt was able to heal himself, but we know that there are some people who are severely immunocompromised, like those with an AIDS diagnosis or those with cancers that might be on immunosuppressives that really make it hard to fight off a virus. And so that's why we have medications like that antiviral that is available. Just wanted to mention, because I know that this has come up as well, which is access to that antiviral. And so that antiviral is FDA approved currently for smallpox on an emergency use authorization, and it is an investigational new drug, meaning that it is currently available, but it requires a lot more paperwork. And so we're working very closely with community providers in order to get them up to speed on this medication, in addition to offering the medication in our public health clinic as well.
Dr. Moore, just to be clear, the medication you're referring to, the antiviral, this is T-Pox, correct?
Correct. T-Pox or tecovirimat, yes.
Okay, and the availability right now in LA County, can you talk about that?
Sure. So the availability in LA County, at this point, there are between 20 to 25 providers that are offering tecovirimat. And with every new case that we identify, we are connecting directly with primary care providers to get them on board, to educate them about tecovirimat and to help them get the medication so that they're able to care for their patients. And if they are unable to care for their patients, or if a patient is uninsured or doesn't have a provider, then we work closely with them to either see the patient in our clinic or to work with other clinics that accept patients who are uninsured. So, we're working really hard to get this antiviral available to folks who need it, particularly those with, as I mentioned, excruciatingly painful lesions or severely immunocompromised persons, as the majority of people will recover without the need for this antiviral. Thanks.
Thank you, Doctor. Troy, I understand you have a question?
I hope it's a question. It's kind of a comment, too. It seems to me that several things can be true at one time. I mean, like we have a vaccine. We didn't have a vaccine for HIV, yet we were able to modify our behavior in a way that prevented like a total absolute catastrophe. And I think the same is true here. We don't know about the efficacy of this vaccine yet, but we know it works to some degree, and we want to get it out as quickly as possible. But in the meantime, what is the threshold for getting the vaccine into the community before transmission is not a nightmare?
It's a tough question. I mean, we really just need to be getting vaccine into the at-risk population right now. You know, I think like what we really want to try to avoid is more transmission happening, and every day more and more cases are coming. So it is a race, you know, and I honestly feel like we are behind the curve because we don't have...
You said it was a race to prevent transmission.
Yes,
okay.
To prevent transmission.
So if that's the case, then what does the LA County Public Health Department have to say to the community about how we can have personal responsibility in preventing this from just going wild? And what is the likelihood that it will if we don't?
Yeah. So this is prevention, so I'll hand it over to you.
Sure, thank you. You know, so the message that I've been sharing is it's really important for everyone, as monkeypox, you know, can be spread to anyone, to really assess our own risk, you know, so thinking about the ways in which we are behaving that may increase our risk for monkeypox. We know that monkeypox is spread through skin-to-skin contact, through the sharing of respiratory droplets, if it's kissing, sneezing, coughing, etc. We know it's also spread through intimate contact, so, you know, having sex with multiple partners. So based on what we know about how this is spread, it's up to each and every one of us to think about the ways that we can mitigate that risk and prevent the spread. It's similar to COVID. It's going to take all of us.
And I guess my final sort of thought is that I'm sure Dan can handle this, and so could Dr. Mimiaga or any of us, anyone in the community. What does behavior modification mean? I mean, we know what our community is capable of. We just went through a 40-year pandemic. We just went through a 3-year pandemic, and we're still in both. And there's a great deal of anxiety, as Dr. Mimiaga talked about, but now there are these ideas being introduced about potting and pausing. What does that mean?
I'll start, then I'll be very happy to turn it over to you. Safe sex no longer is as simple as, and these three options weren't even simple, of condoms, PrEP, and having an undetectable viral load. But what we've also learned is that there are things we can do to reduce our individual risk, our partner's risk, and our community's risk. There's this not very helpful phrase that is anonymous sex, and people have been saying you got to stop anonymous sex. There are different levels of that, right? You can have sex with someone who you have no information about whatsoever, and the likelihood of having a conversation with them may be minimal depending on where you're having sex, if it's in a public space or not. On apps, you actually have some basic information more often than not about who your partner is, what their sexual health strategies are. You can have some of the conversations right online or just looking at a profile, when that can often be much easier than having a conversation in person. It also really helps you notify your partners. And again, I can't stress that enough of how important that is. And again, you can do it either personally and directly, like it sounds like it was fortunately what happened to you and your partner. It can also be done anonymously again. And, there was a question about, well, why aren't we talking about safe sex? Those are all components of safe sex. Those are all components of how we can reduce the risk, not only for ourselves, but the whole community.
Just so the audience knows what the question is, can you address potting and, I'm sorry, what was it?
Does pause.
Does everybody know what
potting and pausing, what does that mean?
So pausing would be, slowing down or stopping, your sexual activity altogether. Potting would be having sex with, a set group of people, irregular buddies that you may be both vaccinated. These things would lower or minimize your risk. One thing that I think is important to point out is this isn't considered a sexually transmitted disease, although it is transmitted in this case through skin-to-skin contact. So we don't know yet whether or not the virus is transmitted through vaginal secretions or semen. So, I think it's important to make that distinction that it's not yet considered a sexually transmitted infection, because that only, particularly among men who have sex with men, further stigmatizes us. So.
Dr. Moore.
Thanks, Dr. Mimiaga. So I did want to just briefly mention, although we don't know if it's transmitted through semen, we do know that we've been able to identify the monkeypox virus in semen. So we actually are recommending that, after a person heals from monkeypox, that they continue to wear a condom for a few weeks after, or to wear a condom for a few weeks after, as we aren't sure if it can be transmitted that way, and just want to keep everyone safe.
Just getting a couple of things. We've been talking a lot about the impact of what we learned about HIV prevention that we can apply here. There's a lot of lessons from COVID and the kind of messaging that went out around create a pod, create people in your home, and maybe a couple friends that you can commit to just socializing with each other, and that helps reduce the spread everywhere else. A lot of people, and I think all of us in this room have probably at one time or another criticized the CDC for how they've handled different diseases, and I already see some shaking heads. But we should give credit where credit is due. If you look at some of the information that they're putting out right now, I've never seen information in 40 years which is more appropriate for gay, bi, and trans men, being very explicit about what kinds of sex will keep you safest, how important it is. And even, when you hear the head of HIV prevention for the entire country say, hey, maybe it's time you have either virtual sex or you masturbate near someone, but the whole goal is reducing that skin-to-skin contact. So I think it's worth watching that. I'm sure if you go to YouTube and you search sex and monkeypox and CDC, it'll turn up on your screen pretty quickly.
I think it's also all the concepts about minimizing the spread right now, like in addition to the vaccine, and I ask about threshold of the vaccine. I just wanted to point out that. And I'm just like a lay epidemiologist here, so I'm thinking it's a temporary state. Once we knock this out with a vaccine, with our behavior modifications, and et cetera, we can go back to a normal life without the same level of fear that we currently might have. And I think that that's an important point to make. We're not talking about a lifetime commitment. We're talking about through August 23rd, at least, till the day the vaccines start slowly filtering into the community. So that's why there was a book called Sexual Ecology during the end of the AIDS crisis, which talked a lot about how there was a threshold for transmission where it was no longer quite the same crisis. So I'll be more comfortable when we know what the threshold level is. So anyway.
Wanted to make one comment, is that we need to take care of ourselves and each other. And I want and implore people to learn more about this virus and about this disease. I saw my first patient the first or second week of June, and I understand there was not a lot of information out there. But as I see more and more patients with monkeypox, I've heard of some who did not necessarily take precautions when they started having symptoms. So for people who now know more about the constitutional symptoms, fever, headache, malaise, and more obviously the skin rashes, if you have something that looks like a red bump, either in your throat, rectally, on your genitals, or your face, talk to your healthcare provider. Just make sure. And I think that's a great time to pause. Pause and get evaluated before you engage in more physical contact.
And if I may throw in 2 cents with that as well, in addition to any behavior modification to help try to curb this, something that I've seen and participated in that I think is very heartening and important is members of the community sharing their experiences, not just speaking out publicly, but in fostering information to each other and listing out, like I, for example, created a Google Doc called So You Got Monkeypox, and it is by no means a medically trained document, but it is a series of things I experienced and things I talked about with my doctors, and it encourages people to check out resources in the CDC and to speak with their doctors about potential remedies, et cetera. And that also helps speak to stigma as well, because there's no place for shame or stigma in getting this. People have not done anything wrong in getting it. It's just the way the cards have fallen. And so I think that community aspect is really important to help us take care of each other with queer and bi men, trans individuals who are getting it, and beyond.
All right. Thank you very much, guys. A few more questions.
My name is Andrew Beaver, and I have a question about the eligibility for vaccinations in this critical period between now and when we have more doses. You've identified a group of people that we're considering high risk. You've given them some criteria. If you listed one criteria in particular that says they've attended a bathhouse or a sauna or a sex party. And yet when you go to the next page and look at the proof of the eligibility, there's no way for them to prove it. So we've got a significant group of people who are indeed part of the people we really want to get the limited vaccines into them, and we've identified who they are, but not given them any way to prove their eligibility. So if you could speak to that and let us know how we can address that.
Thank you. Right, so, again, it's quite complicated, right, because we have such limited supplies. So there's several ways. You can go to your provider. The provider can attest to any of these eligibility criteria. If there's that relationship, he can attest, or he or she can attest, then you can use that as a documentation and provide that at the vaccine site. The online portal was really a way to self-attest. This is where people could just say, I meet one of these criteria, including that third one, and then submit and say, I want this vaccine, this is where I'd like to go and when I'd like to go. So that's what the online portal really was made for, was to really increase the access to those so that they can self-attest to certain behaviors. We also have vaccine clinics that have been set up at the 4 bathhouses. There has been 2 clinics. They've been really successful. There's going to be 2 more on Saturday and Sunday. We've been partnering with JWCH, who's been amazing, and that has been successful. So we are also going to the site and advertising about it and providing vaccine on site.
Then one more quick question. Is the portal still open? Is the portal open presently?
No, the portal is not open because we reached...
Portal is not open. Okay.
Yeah, we reached capacity.
Okay, so the solution to this concern is a little bit limited right now.
Right.
If people go to a testing site and they make the effort to drive from West Hollywood to San Fernando, and they say that a party promoter called me and said, I was exposed. You may have been exposed at the party that you paid to go to. Sorry. And they actually go and tell that story to the person, and then they get told, well, that's not an official contact trace source, and they get turned away. Is there a way for us to have a little flexibility at that desk out in San Fernando or Santa Clarita or South LA or East LA, which really isn't here, but is there a way to kind of have a little flexibility to allow those people who are willing to self-identify get their vaccine? Because we've seen them turned away. We've witnessed it. They drive all the way out there. They're willing to get this. They know that they're in this eligible group, and they're being turned away. And that just doesn't work. So we have to work on trying to fix that.
Absolutely. I mean, again, we're only reaching a small percentage of the people that need the vaccine. The portal really was the way to be able to do that, for people to say, hey, I am at risk. I have engaged in high-risk behavior. We anticipate that that portal hopefully will get open up next week if vaccine comes by next week. But as soon as we know, that portal is going to be open, and that really will be the main way I think that people can sign up for vaccine. And really, it should be about self-attesting to your behavior rather than having a provider have to attest to that.
His comment was, or have a county person tell you you can't get it.
This is what we witnessed last Sunday at the San Fernando site. And all we're trying to do is say, we're trying to tell you that this issue is out there and allow you guys to sort of come up with solutions, not to put you on the spot at all.
No, we totally understand and want to get as many people, vaccinated who are eligible as possible. The challenge is just we have so few doses that we have to focus on the people that clearly meet our eligibility criteria and can provide some type of proof. Within the next, few weeks, we are expecting, when we have more doses, to be able to reopen the portal, as was mentioned. We're also working really closely with the state to open the My Turn system to have Monkeypox added as well, so that way people will be able to more readily find appointments that are available to them. So we're doing everything we can as quickly as possible to get these doses here and get them out to everyone.
I know we have two questions right here. Real quick, though, follow-up. Dr. Kim, I know you just mentioned, you said that there are walk-up sites at some of the men-only bathhouses. What are the names of those places, and what are the days that those walk-up locations are available?
I don't know the names. I honestly don't. Yeah. I know that there's 4 commercial sex venues.
Could you hold the mic up to your mouth so we can hear?
Sorry, I know that there's 4 commercial sex venues, but I actually honestly don't know the names. But what I would suggest to do is just, we have a community partner, JWCH, that's working with us. JWCH has very good relationships with these venues, and I think they could provide more information.
You did mention a couple of days of the week in particular, though. What days were those? A moment ago, you mentioned Saturday and Sunday?
I think over the weekend, yep.
Saturday and Sunday? Okay. And JWCH, for anyone watching in our audience, JWCH stands for?
John Wesley Health Center.
John Wesley Health Center. Okay, so that's a resource people can look into. Do you have a question? Please introduce yourself.
Good evening. Good evening, panelists. My name is Edward Spencer. I am a member of the community and a physician. As far as our important discussion about the vaccine this evening, it's my understanding that the Genios vaccine had actually been one that was studied, tested, and approved by the FDA prior to this outbreak for the treatment of smallpox and monkeypox, as compared to some of the newer vaccines, such as the COVID vaccine. So I'm wondering if y'all might be able to speak to what we do know about the safety of this vaccine in various populations. Thank you.
So the data is pretty limited from what I can see from the package insert and from the CDC. It's based off of animal models. The safety so far has been well tolerated, both from what is written in the literature and from my very small experience with my patients with the monkeypox who have received vaccination. I think the question of safety is not one that has been raised as an issue so far. I'm sure we'll learn more as this vaccine gets distributed globally. And just like with the COVID vaccine, we only know what we know from trials and from a very limited amount of experience. I think the bigger question that we all are going to ask and are asking is how efficacious is this? And again, I want to emphasize, this is what we have. From animal models, it is at least 85% effective. At least that is what has been determined by the CDC off of the information that they have. And so at this point, there are no signals for us to be concerned about distributing this vaccine. And I do encourage that we promote this vaccine, although with a bit of caution, and with everyone knowing that we as the medical community will update people as we get more information.
Just one other thing that I just would like to add. So on the CDC's website, you can also find a comparison between Acam 2000 and Genios, which was also mentioned earlier. And in that comparison, the only main concern was if a person had an allergic reaction to a component of that vaccine. So at least in the data that we have, it looks to be really safe. And I agree with Dr. Ho that we should really promote the distribution and administration of the vaccine. Dr. Mimiaga?
One quick thing, the difference with the COVID vaccine is that it was tested in randomized controlled trials, double-blind trials with human subjects, whereas this vaccine, it was FDA approved from, as was said, animal studies without human randomized trials yet. So that's the difference.
Okay, thank you. Did you have a question? And please introduce yourself.
This is a little, okay. Hi everyone, my name is Alexandra Magallon, Coordinator of Policy Community Engagement at the Latino Coalition. My question is, thank you Mariana Marroquin for bringing up language access, which is really important. I'm sitting in the back with the Latino Coalition, and the majority of us are Latino identified. And it breaks my heart that they were asking me, as I'm trying to listen to you, what y'all were saying. So just the fact that we don't have language access here is a little disappointing, to be completely honest with you. But to the point of what I'm gonna ask to LA County and the Department of Public Health is knowing that the rates are so high for the Latino population, from the numbers that were shown. And knowing that COVID-19 also affected the Latino population here in LA County, and also knowing that HIV infection also is a very high number for the Latino population, what is the county, and also to including the city of West Hollywood, doing to make sure that language access for people who are Spanish speakers are able to get this very information that you're touching on, because it's our communities that are the most impacted. So while I am here listening and grasping all of the information that you're saying, a lot of our community members that are deeply affected and impacted by this may not even have access to Medi-Cal, or may not even have access to the very clinics that you're working with. And just as one of the members that just spoke had been turned away from one of the clinics that you partnered with, who is also the high-risk persons, just because they do not go to that clinic. So how do we hold the organizations that you're working with accountable to be able to provide these services or these vaccines to the people that really do need it? And I love that we're talking about prevention, but unfortunately, a lot of our community members, the transgender community, is not able, doesn't have that ability to be able to prevent. A lot of us are discriminated against just by who we are, so we're not oftentimes employed, or maybe we're undocumented and we had to cross the border to live here, and so our access is very little because we're not able to, one, get an authorization for employment to be able to have a job here, so we resort to sex work. And so knowing that a lot of our community is impacted by a plethora of issues, what is the county doing for the Latino population, specifically the transgender population? Thank you, Mariana Marroquin, for bringing that up. It was very important.
Thank you.
Thank you. I mean, these are really, really important issues. I mean, our community partners that we've been working with, we really chose them very carefully because these are groups that are working with gay, bisexual, transgender persons in an equitable way. You know, we really wanted to partner up with clinics that are reaching, the vulnerable groups. So within our network, we have chosen partners that really do span across, all different demographics and also across the county and geographic areas. But yeah, I mean, I think the issue unfortunately, like it breaks my heart to hear that people are being turned away, and it really is a supply issue. And in addition to that, you know, I think it's really important for us to make sure that clinics include the vaccine in their routine clinical care. It's got to be sustainable. This is where the vaccine should be. Really, we need, I mean, it's the community that has partners with community. And so, you know, we just need to make sure that more and more community clinics and community partners are with us together in doing this. But, you know, it's hard. It's hard to set up a vaccination program. So I think that's also another thing, is the logistics of setting this up quickly. Why don't I hand it over to you?
Yeah, and I'd just like to add to that, thank you. You know, I think it's also important, language access, so thank you for raising that. And I will say that for us, you know, on our website and our materials, we work to ensure that there's English, Spanish, and the other threshold languages, like including on our schedules and on our website. So it's really important to us, and also to have translation services available in our clinics as well, so that if people are coming into our clinic, then they're able to have an appointment with the provider that each can understand each other and give the best possible care.
Yes, please introduce yourself.
Hi, I'm Carrie Balbone. I'm a resident of West Hollywood, and I also work in healthcare. Thank you so much for this event. It was incredible. My question relates to the fact that in hearing, Matt, your story, and how it impacted you, there are people in our community who are highest at risk, who are living in situations with unstable housing. And to me, your symptoms sounded pretty horrible, and I'm housed. There are people who would be dealing with what you dealt with, who don't have a place that's safe, and who probably will be kicked out of the place that they're in when they become symptomatic. And then you add to that what we just heard about people who do sex work for a living, 2 weeks out of work, I mean, in the middle of being really ill. So my question is, what are you all thinking about for that part of the community that's at high risk? And are there respite beds? Are you thinking about strategies? And what can we do to help?
Thank you for that question, and I'll, of course, pass this on to the professionals here who have the official answers to that, but I do just want to take a moment to, recognize the absolute truth of what you're saying, because I was quite privileged in my experience going through this. Even though it was excruciating, I had housing and a safe place to recover and access to timely testing and whatnot, and I know a lot of people who do not have that. Even I was just recently in New York, and I have friends there who are in the service industry or who are sex workers, and chatting with them, you know, if they came down with this in the same way I did, they would be out of paychecks. They would be unable to pay rent. They would find themselves in a far worse situation than I did. So I do think that is something that is paramount importance to consider.
Thank you, Matt, and thank you for that question. Very important question. And so I think it's important to share with everyone that for every monkeypox case that's diagnosed in Los Angeles County, that person is assigned a public health nurse. And that public health nurse does a full intake with the person, you know, including asking questions about contacts, but also asking questions about housing, food insecurity, et cetera, because we know that those social determinants of health are so important. And if it's identified that that person, you know, has those challenges, or their roommate kicked them out, or is uncomfortable having them there, or family members kick them out, then we do have beds available, and we have vouchers for food, et cetera, transportation. All of those needs we can meet during that time. We also really recognize that, you know, 3 weeks out of work is really difficult, you know, for people. And so we try to ensure that during that time that we're at least able to, you know, cover those immediate living needs. Thank you.
We are reaching the end of our event. I think we have time for maybe 1-2 questions tops. I saw your hand first, and then we'll come to you, okay?
Thank you. So I'd like a further explanation of exactly what skin-to-skin contact means. Is that skin to skin with a lesion, or is it just any skin to skin if the virus is being shedded from the body? And then secondly, what would follow that is my concern for certain people in industries, such as massage therapists who have skin to skin contact. Are we taking into account protecting workers in industries that are high risk? Because everything I've heard of doesn't really do that. I think that's something we need to think of. If we learn anything from COVID, was that our frontline workers needed to be protected. So I'd like to know if there's a plan to protect workers, since again, having 3 weeks off is a big problem, and this is a source of income for folks.
I don't know, do you have a microphone? Oh,
thank
there you go. Sorry.
Thanks. So in regards to the first question on skin-to-skin contact, when we say skin-to-skin contact, we're saying contact with a rash. So it would be with a lesion, which unfortunately, because the lesions go through so many stages, that first stage is like, it's a flat stage. So you may not be able, to know that you're coming in contact with a lesion, which is another reason that I get really concerned about kind of the stigma, right? Because you could be hugging someone who has a lesion that you don't even recognize it as a lesion. Maybe you think that that's a mole or something. So that's one thing that I will say. And then regarding protecting workers, we really do work closely with Cal OSHA. Really important for us to partner with them to determine what are going to be the steps that we would use to engage with workers around how to best protect themselves. So we're working closely with them. And at this point, I don't have any updates, but I think soon, we will have more updates as we see more cases.
Sorry. I just had an adjacent question, like Beverly Hills. In that light, what does safe sex look like? What does safe sex look like?
I feel like I've tried to say this in as many ways as I can, but safe sex is taking care of yourself by making sure that if you have any symptoms, you do everything you can not to pass it on to anybody else. If you think you've got a rash, go to your healthcare provider. If you're gonna meet up with someone that you don't know very well, that's going to put you at greater risk if it's a situation where you have no information about them. If you go to a public venue, a park, wherever you go, I'm not saying yes, you have the right to do it, or no, you don't have the right to do it. The challenge is, how are you going to get in? How are you going to be able to see if someone's got lesions? How are you going to be able to get any information from that person? How are you going to know if you can get contact information from that person? That's going to put you at higher risk. The next level down, of course, would be meeting with people on apps where you can exchange a lot of information. And, again, safe sex is about potting and pausing. It's about thinking about who you're going to have sex with, how many you're going to have sex with. And the good news is, if we're all lucky, in mid-August, late August, there's going to be a whole lot more vaccines, so whatever pausing we're going to have to do, it's not like COVID, where we had no idea how long it was going to be. And if people don't know how long it's going to be, they're going to throw up their hands and pretty much everything else and say, I'm going to go do whatever I want to do. If you know it's only for 6 weeks, that's an achievable goal for a lot of people.
I know you had a question. Please introduce yourself.
Hi, my name is Emmanuel Munoz. I'm the Associate Director over at Project Q. I'm going to make this into more of a comment because I know we're out of time. So I want to first just echo what Ariana said earlier when she came up onto the mic about moving this discussion outside of just English-speaking spaces, or this particular space in general, right? We're talking about sexual networks, and as a lot of us know, LGBTQ sexual networks expand outside of LGBTQ spaces, right? especially for Latino folks. We're talking about folks who are DL, right, who may not come to seek information or may not come to places like this because it puts them at jeopardy as well too, and then that comes back to us to, you know, raise infection as well too, so, or transmission. So that's always something super important to echo as well, just to look outside of these spaces. Also for sex workers who may have to move in and out of spaces as well too, you know, it's not always just strictly here in these areas. So it's important to spread that message outside of these spaces to, you know, get rid of that stigma and inform folks. My other thing I wanted to say, just to wrap up, is I actually went last week to a clinic to ask about what it would look like, you know, to enter for, you know, for a lot of my folks that I work with, right, to get screened for monkeypox. Our first people that we talked to were normally people at the front desk, people on phones, and they said they did not know and that that's where the journey ended. So our frontline main point of contacts also being trained as well in this effort, or is it going to be having to dig around for the right doctor, the right clinic to find those questions?
So I can definitely say in our clinics that, you know, all of our front desk staff know about monkeypox, and I think, you know, as other clinics are coming on board and as, you know, time progresses, they will know about monkeypox, other, you know, community providers and clinics. You know, so what I would encourage is if you went to a clinic and that clinic told you that their front desk staff didn't know, that you could definitely connect them, for example, with our website, or, you know, I would even put in a complaint, honestly. And the reason I say put in a complaint is that at least that way then it raises it to the radar of the medical director or the business office supervisor, so that, you know, the information gets communicated to that front desk staff so they don't have that issue again. As a medical director, honestly, you know, sometimes we get those complaints, but it's really helpful because then we can actually know, you know, what we're missing and be able to correct it. I will say so much of, you know, what I kind of work on is ensuring that people in the community know how to advocate for themselves too with healthcare, because all healthcare isn't created equal. Thanks.
Okay, thank you, panelists. Thank you, audience. That was great. It's the end. I'll just close real fast by saying two things. First of all, these questions are difficult. The subject matter is uncomfortable, and a lot of healthcare professionals and all of us are still learning. So I want to thank all of you for being here, for taking these candid questions. It's tough stuff, but we don't just appreciate your expertise, we need it because we use it every day. So thank you. So thank you to all of you, and thank you for your questions. They were very thoughtful. One quote I'd like to leave you with. Dr. Anne Ramoyne is an epidemiologist with UCLA. She's also on the committee on monkeypox for the World Health Organization. She recently said, "We have to get in front of this. It's clear that the window of opportunity for doing so is closing." One theme we've heard over and over tonight is that we are looking at a 6 to 8 week window by which we can get in front of this thing. 6 to 8 weeks. So when you talk to your friends, you talk to your lovers, you talk to people in the community, remember, 6 to 8 weeks, we could really, really make an impact. Thank you again for being here. And as you're all leaving, I also just want to extend a huge thank you to Troy Masters and the Los Angeles Blade. Thank you so much, Troy. I'm sorry I didn't say so first of all. Thank you again for coming, everyone.